Hello friends, today we see the type 3 and type 4 sensitivity reactions in this video. In the previous two parts of the video, we see type 1 and type 2 hypersensitivity reactions. Now type 3 hypersensitivity reaction. This type 3 hypersensitivity reaction is an immune complex and it results of antigen-antibody immune complexes which influence or induces an inflammatory reactions in the tissue. The reaction between the various antigens and antibodies in the body gives rise to the formation of immune complexes. In the normal condition, mononuclear phagocyte system remove these type of immune complexes through participation of RBCs. In certain cases, these immune complexes are beyond the reach of phagocytic clearance capacity. As a result, they can increase and cause the disease. Immune complexes deposition at the site on blood vessel walls, in the synovial membranes of the joint, on the glomerular basement membrane of the kidneys, on the choroid plexus of the brain. Sometimes immune complexes form at the site of the inflammation itself. These immune complexes fix and active the complement system. Complement fixation result into the production of the anaphylotoxin chemokines C3A and activated C5 that stimulate the release of vasoactive amines. After activation or stimulation, activated C5 attract the neutrophils to the site of inflammation or site of reactions. But these neutrophils fail to phagocyte large aggregated mass of immune complexes and instead release lysosomal enzymes and lytic substances that damage the host tissue itself. This type 3 hypersensitivity reactions is also known as immune complex hypersensitivity. This may take 3 to 10 hours after exposure to the antigen, and it may be general or may be involve individual organs including or other organs also. Antigens can causing immune complexes mediated injury which may be exogenous and endogenous. Then mechanism of the type 3 hypersensitivity reaction, that means how they developed in the body. Antigen combines with antibody within the circulation and form immune complex, like as we already seen, where in the body they are deposited, they activate the complement system. Polymorphonuclear cells are attracted to the site and results in the inflammatory tissue or injury happen. After this mechanism, we see the symptoms of the hypersensitivity reaction type 3. As a result of this sensitivity reaction, complex deposition in the tissue can give rise to symptoms like fever, rashes, joint pain, lymph node enlargement, and proteins in the urine. These are the common symptoms of these reactions, and it may require 3 to 10 hours for the symptoms to occur after exposure of the reactants. Here we can see the examples of the type 3 reactions, the local reactions and systemic reaction. Example of local reaction is Arthur's reactions, in which inflammation is caused by the deposition of immune complexes at a localized site. Clinical manifestation of this reaction is hypersensitivity pneumonitis. And another example is systemic reactions. Systemic reactions in which serum sickness. In the systemic inflammatory response to deposited immune complexes at many area of body, few days to 2 weeks after injection of foreign serum or a drug, it results into the symptoms like fever, urticaria, arthralgia, eosinophilia, splenomegaly, and lymphadenopathy like conditions. The immune complex diseases like hypersensitivity pneumonitis, glomerulonephritis, rheumatoid arthritis, systemic lupus erythematosus are also known as immune complexes diseases which involved in the type 3 reactions. The hypersensitivity pneumonitis, it is the inflammation of the lungs in which basically alveoli of the lung are involved in the reactions. This pneumonitis is commonly occur due to the exposure to the dust by their occupation or hobbies. In the pathophysiology or development of these diseases, which involves the inhalation of antigen, and this lead to exaggerate immune response, that is hypersensitivity, and it can occur depending on the cause of the diseases or reaction. Then the diagnosis of this hypersensitivity pneumonitis is based upon the history of symptoms after exposure to the allergen and clinical test. Some blood tests are involved for the diagnosis. Again, the signs of inflammation, chest X-ray and lung function test can be done for the confirmed diagnosis. And to prevent this condition or the reactions, the best treatment is to avoid the provoking allergens. In chronic exposure, it can cause the permanent damage to the tissue or organ. Also, along with that, corticosteroids such as prednisolone may help to control the symptoms, but it may produce side effects more. Second condition is glomerulonephritis. It is a term which is used to refer to several kidney diseases, usually affecting the both kidneys. This disease is characterized by inflammation either of the glomeruli or of the small blood vessels in the kidney. Hence, it named as glomerulonephritis. In the pathophysiology of this glomerulonephritis, immune complexes in the blood are deposited into the glomeruli. A damage to the glomerular cell impairs blood filtration, and kidney fails to do their normal functions, and ultimately death can cause. The common signs and symptoms of this diseases is nephritic syndrome and nephrotic syndromes. These two diseases, like the nephrotic syndrome, is in which the edema is finding in a person with increased protein level in the urine and decreased the protein level in the blood with increased fat in the blood also. And nephritic syndrome is a condition which is characterized by blood in the urine, especially RBCs are present in the blood, and decrease the amount of urine in the presence of hypertension. This is nephritic syndrome. This disease can be diagnosed. Forms glomerulonephritis are diagnosed clinically based on finding on the history and examination of the particular person or individual, and tests may include urine examination, blood test investigating cause and including inflammatory markers, then special tests like complement levels, anti-nuclear antibodies, and so on. Biopsy of the kidneys can be done. Also, renal ultrasonography is useful for prognostic purpose in the finding signs of chronic kidney diseases. The antibiotic therapy to prevent the infection or is also recommended in the prevention or management of the glomerulonephritis at prophylaxis stage. Steroid also prescribed to suppress the immunity, and high calorie and low protein provide. Again, sodium and potassium diet also given. Monitor the signs of kidney failure, heart failure and hypertensive encephalopathy specifically in this condition. So next disease is rheumatoid arthritis, in which immune complexes deposited in the joint. They results in the release of inflammatory chemicals. The joint begin to break down and become distorted. The trigger mechanism of this arthritis is not well understood. Treated with anti-inflammatory drugs which suppress the inflammatory responses. Then next one is the image which shows the crippling distortion of joint, which is the main characteristic of the rheumatoid arthritis. Similar joints are affected in this condition. And the last example of this hypersensitivity is systemic lupus erythematosus. This is the condition. Technically it is known as systemic lupus erythematosus, or it also known as lupus disease. It is an autoimmune disease in which body's immune system mistakenly attack healthy tissue in many part of own body, and antibodies works against DNA, result in immune complex formation. Many other autoantibodies can also occur against the RBCs, platelet, lymphocyte, muscle cells. Mechanism of this SLE also totally unknown. Immune suppressive drug which reduce the antibody formation or suppress the immunity. Glucocorticoid also be prescribed to reduce the inflammation. Some signs and symptoms are specifically in these diseases, in which the butterfly rash occurs on the face of that individual. Along with that, fever, malaise, joint pain, muscle pain and fatigue also occurred. Also there may be a chances of arthritis along with this condition. Then muscles and bone also involved, in which joint pain and sometimes osteoarticular tuberculosis can be caused. Medication to prevent the flares and reducing their severity of this SLE can be include corticosteroid and anti-malarial drug. Certain type of lupus erythematosus which can cure with the help of cyclophosphamide and mycophenolate. Cyclophosphamide increase the risk of developing infection, pancreas problem, higher blood sugar and high blood level also. Therefore it can be monitored during the treatment. Also hydroxychloroquine also treated used for this condition. Along with this, the medication with disease modifying anti-rheumatic drug also treated in case of joint involvement is there. Again, immune suppressive drugs like azathioprine can be prescribed. Along with that, analgesics also given. Then IV immunoglobulins are suggested, and if the kidney failure, then end stage kidney diseases, then suggested to the kidney transplantation. These are the treatment for the or the management for the lupus erythematosus. This is the facial rash of the systemic lupus erythematosus. It can see like this. Now, after type 3 reactions, we will move towards the type 4, that is cell-mediated hypersensitivity reaction. It also called as delayed type of hypersensitivity. This hypersensitivity is a function of T lymphocyte, not antibody. This type 4 sensitivity reaction are mediated by antigen-specific activated T cells. When the antigen enters the body, it proceeds by antigen-presenting cells and present together with the MHC2 to a T helper cells. It starts in hours to days after contact with the antigen and often lasts for a day. It can transferred by immunologically committed T cells, not by the serum. Principal pattern of this immunologic response to a variety of intracellular microbiologic agents like Mycobacterium tuberculosis, viruses, some fungi and parasites. If the T helper cell has already been primed to that specific antigen, it will become activated and release chemokine to recruit the macrophages and cytokines such as interferon to activate them. Then basic mechanism of this reaction is activated macrophages releases pro-inflammatory factor which leading to focal swelling, edema, warmth and redness. They also secrete lysosomal elements and reactive oxygen species, again leading to the local tissue damage. CD8 T helper cells may be involved in the type 4 reactions where foreign antigen is detected on a cell such as organ rejections. This is known as cell-mediated cytotoxicity and also results in the recruitment and activation of macrophages. This reaction is known as delayed type of sensitivity reaction due to its characteristic longer time period to appear following antigen exposure. The reaction takes longer than all other types because the length of the time required to recruit the cell to its site of exposure around 24 to 72 hours. This is the pathogenesis of this type 4 hypersensitivity reactions. Common signs and symptoms of these diseases is contact dermatitis. Montauk's tuberculin test can be done to detect this type of reactions. Here we finish the hypersensitivity reactions type 1, type 2, type 3 and type 4. What are the reactant are included in this mechanism of all hypersensitivity reaction, time course and their prevention, how to prevent them. So thank you all of you.